Hello students, so now today's topic is hyperbaric oxygen therapy. It is also called as, in short term, it is called as HBOT. So what is hyperbaric oxygen therapy? Hyperbaric, as the name suggests, that means there is rise in the pressure, right? So there are hyperbaric chambers. We place the patient in the hyperbaric chambers, and then the chamber is having pressure of 2 to 3 atmospheric pressure, and we make them breathe 100% oxygen. So 100% oxygen at 2 to 3 atmospheric pressure given to the patient, which is placed in hyperbaric chamber. This is called hyperbaric oxygen therapy. Okay, so hyperbaric oxygen therapy is of two types. First is monoplace and second is multiplace chambers, right? So hyperbaric therapy, which is given in the monoplace chambers, in which only one patient is placed at one time in hyperbaric chamber, while in multiplace chambers we can accommodate more than one or various patients in a single setting. Okay, and in both the chambers we are providing 2 to 3 atmospheric pressure and 100% oxygen to breathe. Okay, so this is called hyperbaric oxygen therapy. What are the indications of HBOT? There are several indications, right? Gas embolism, whether it is air embolism or decompression sickness. Toxicology, like cyanide poisoning and carbon monoxide poisoning, we are giving hyperbaric oxygen. Infections like soft tissue necrotizing infection, refractory chronic osteomyelitis, non-healing ulcers, intracranial abscess, skin graft, skin flap at the risk of tissue death, gas gangrene, which is caused by Clostridium bacteria, crush injuries. We can give hyperbaric oxygen. It is effective in these cases. Also, there are some translational researches going on in the COVID-19, cancer patients, autoimmune disease like rheumatoid arthritis, and aging. Okay, now, so let me explain you one thing, that the arterial total oxygen in the blood, it is denoted by CaO2, which is approximately 20.4 ml per 100 ml of the blood. It is the total amount of oxygen which is present in the blood. It consists of two things. First is hemoglobin bind oxygen, and second is dissolved oxygen, right? So the formula is CaO2, which is total amount of oxygen in the carries by the arterial blood, equal to 1.39 into hemoglobin, which is in the grams per deciliter, then SaO2, which is effective hemoglobin. That means hemoglobin which is bound to the oxygen. It is the saturation of that hemoglobin, SaO2, plus 0.003 into partial pressure of oxygen. It is denoted by PaO2. So this is hemoglobin bind oxygen, and this is dissolved oxygen. So this amount is approximately 20.1 ml per 100 ml of blood, while dissolved oxygen is approximately 0.3 ml per 100 ml of blood. 0.3 ml, that means it is approximately 3 ml per 1 liter of blood, right? So while we are giving hyperbaric oxygen therapy, then this become approximately 60 ml per liter of blood. That means 20 times more than the normal oxygen, dissolved oxygen in the arterial blood. Okay, let me explain you one thing. Like I am standing here, I am breathing room air. So this temperature, atmospheric pressure normally is 1 atmospheric pressure, and I am breathing 21% of oxygen. In 21% of oxygen and 1 atmospheric pressure, in my blood, the dissolved oxygen will be 0.3 ml per 100 ml of blood, or 3 ml per liter of blood, right? But if a patient is placed in the hyperbaric chamber and we provide 100% oxygen to them, and at the pressure of 2 to 3 atmospheric pressure, then it dissolved oxygen turned to be 60 ml per liter of blood. That means 20 times more than the normal dissolved oxygen which is present in the arterial blood, right? So the our basic goal to provide hyperbaric oxygen is, it will cause hyperoxemia and hyperoxia. What is hyperoxemia? Hyperoxemia means increased oxygen content in blood, while hyperoxia means increased oxygen content at the level of tissue. So this is very beneficial, because because we are giving hyperbaric oxygen therapy, so total content of the blood is increased because the part dissolved oxygen is increased, right? The total amount of arterial oxygen content is increased, so more oxygen is provided to the injured tissue. And there is also hypoxia, that hyperoxia, that means more oxygen at the injured tissue level. So it will cause antimicrobial effectiveness, antimicrobial property, immunomodulatory property, and angiogenesis means neovascularization. There is increased oxygen at the injured tissue level. What it will cause? It will cause vasoconstriction. Vasoconstriction will cause, there is no edema, there is less leaking of blood vessels, there is less edema, less inflammation. So these are the property of hyperbaric oxygen. It will also promote fibroblast angiogenesis and fibroblast activity. So fibroblast will induce more collagen, and that will promote healing also. So when we provide hyperbaric oxygen, it will have antimicrobial property, immunomodulatory property, angiogenesis property, and also it promote healing. Okay, now, like many other procedures or therapies or treatment, hyperbaric oxygen therapy is also associated with some risk. Though hyperbaric oxygen therapy is safe procedure, but some uncommon side effects are there, which is like short-term change in the sight, ear pain leaking from the middle ear, headache, sinus pain, running nose, nosebleed may be seen, short-term decline in lung function. Rarest of rare side effect is lung collapse and seizures from the high oxygen content in the CNS. So this is all about hyperbaric oxygen therapy in short. Thank you so much.